Thank you. Senator Polley.
Thank you, Mr Acting Deputy President. I rise today to speak about some of the challenges that an ageing population presents for Australia. Plenty of people have spoken in this chamber and in the other place about these challenges before. One of Labor's most unrecognised but vital achievements was passing the Living Longer, Living Better reforms. Our commitment to older Australians has been outstanding, and the member for Port Adelaide and Senator Collins, and indeed their staff, should be particularly proud about what they've been able to accomplish. But of course, the matter of an ageing population is still something that Australia must consider carefully. We all know what problems we face as a first world country with baby boomers heading towards retirement. Politicians from across the political spectrum have repeated the statistics that many of us have heard many times before. They are sobering. The amount we are spending on healthcare in this country is rising at 6% per year. This is twice the growth rate of the GDP. Our spending on hospitals is accelerating dramatically. They're receiving some $18 billion a year more than they received a decade ago. A considerable percentage of this expenditure is, of course, dedicated to looking after older Australians, and this quite simply is unsustainable over time. According to the Productivity Commission, total Australian government spending reported on ageing and aged care service is now close to $13 billion a year. This, of course, won't get any easier anytime soon. As I stand here today, just over 10% of the population is aged over 65, but by 2050 it will be close to a quarter. Because health costs are higher at the end of life, the vast bulk of the nation's health budget will soon be spent on older people, many of whom will be retired and not paying tax. By the time we reach the point where 1 in 4 people in this country is aged over 65, the number of people of working age in Australia, 20 to 64, relative to older people, 65 plus, will fall from the current ratio of 5 to 1 to a daunting 2.5 to 1. The problem of attracting staff to work in residential facilities is also well known. The work is incredibly taxing, the responsibility is immense, and the financial reward far from generous. The Productivity Commission has pointed out that increasing numbers of residents with higher and more complex care needs have added to the workload of care staff in residential care settings. As we speak, some 50% of the aged care workforce is within 10 years of retiring and is proving particularly challenging to attract young, capable people to undertake this line of work. So I want to be absolutely clear when I say that the challenges we face in this country with an ageing population are immense. Every politician, every expert in the field, every stakeholder, every aged care provider knows it. But today, I don't just want to speak about the problems we face due to an ageing population. I want to speak about opportunities that are right in front of us. I want to talk about how we can innovate to take that next step to save billions of dollars in public health expenditure, but also to ensure that older Australians live their lives with greater comfort, dignity and independence. I want to talk about solutions which are not only within our grasp, but more than achievable if we demonstrate foresight and think creatively. So what about the solutions? What is the best way to confront this? Well, we have to act as if we are to ensure that we are properly look after our older Australians, but we can't compromise economic growth and expenditure in other areas. I think that everyone in this chamber, in this entire building, would agree with that statement. But here is the key. Improvement has to come from efficiency gains, not spending cuts. In this context, it's very much worth heeding the words of the Grattan Institute's Stephen Duckett and Cassie McGannon, who contributed the following, and I quote directly, "Reducing health spending growth would not be easy. As Grattan Game Changers report last year showed, Australia already has one of the OECD's most efficient health systems in terms of life expectancy achieved for dollars spent. Sweeping cuts to health funding or shifting costs to consumers could have serious consequences. Blunt cost-cutting risks reduce health and well-being and could ultimately lead to higher government costs due to illness, increased healthcare needs and lower workforce participation. We need to focus on targeted investment. We need to focus on innovation, not simply cuts. Several weeks ago in Melbourne, the former independent member for New England, Tony Windsor, delivered a remarkably candid perspective speech at a Victorian Women's Trust event honouring former Prime Minister Julia Gillard. Mr Windsor was discussing the virtues of fibre to the premise, broadband versus the coalition's model, when he said the following in relation to the current Minister for Communications, and I quote, "Malcolm talks about benefit costs. I make this plea to Malcolm, and there might be some academics in the audience. Someone should do the work on what fibre to the home does in relation to aged care debate long term. We have a significant problem." Peter Costello, making a reference, of course, to our former Treasurer, recognised some years ago in terms of ageing of the population, we're going to have a big bump of older people coming through the system. If 5% of those people could stay in their homes for 1 or 2 additional years, or whatever the number you want to pick, what impact would that have on the capital costs of this bump going through the system? What impact would it have on the operational costs of supplying these beds? What impact would it have on the psyche of the people and their families? He went on, and this part is crucial. It is nonsense to suggest that there is a better way of doing this. If Tony Abbott wants to be the infrastructure champion of the decade, that is the key infrastructure issue. That is the one that connects all the dots: the health, the education, the business and the social aged care issues. It is the one thing that removes distance and remoteness as a disadvantage for country people. The former member of New England is exactly right. If we approach this properly, we will innovate and consider what is best for our ageing population. We can succeed in measurably improving the lives of older Australians while saving the nation's billions of dollars. It's right there in front of us. The answer lies in solutions such as telehealth. Telehealth is not something that many Australians will be immediately familiar with. Previously, when we've talked about technology to help older people, we were referring to monitors which set off alarms if someone fell. But today we can do so much more. With world-class broadband, the sky is the limit. Modern telehealth innovations allow for houses full of sensors which transmit data in real time to monitor things like health and even mobility. What is even more valuable is the use of sophisticated consoles so that these people can speak face-to-face with friends and family and also nurses, doctors and specialists. Instead of admissions to hospitals or residential aged care facilities, we can have monitors of older Australians in their own homes. They will live where they want, they will feel comfortable, they can communicate with others in the process of combating social exclusion, and they can have key health indicators monitored. The technology is advanced enough that the CSIRO's Jeff Hayden, who is working on the NBN telehealth care trial in northern New South Wales, believes that the modern equipment enables professionals to manage and monitor people as though they were in a retirement village while they're still in their own homes. As those who have a relative or friend in residential care will tell you, it's an expensive and complex proposition. The amount paid depends on personal assets, but the average bond paid by new residents is now approaching $250,000. So once again, it becomes clear, staying at home, even for just a little longer, is not only preferable from a health and happiness angle, but it also makes financial sense. The Australian Bureau of Statistics agrees, noting that by regularly monitoring the health of older Australians with this technology, we will not only improve their quality of life, but also help prevent illness or injury. The consultations with health professionals will enable the monitoring of lifestyle risk factors and the overall maintenance of good health. Successful telehealth monitoring saves money in a range of ways, some of which are not immediately obvious. We need to consider reduced ambulance journeys, reduced travel to doctors and specialists, reduced number of acute incidents arising out of chronic illnesses, reduced hospital visits and admissions. The list goes on, and over time, the billions of dollars just keep adding up. Most of the studies on telehealth have come from overseas, notably the United States. However, studies conducted in Australia by the not-for-profit aged and community care provider Feros drew incredible results. Some 80% of clients in a trial reported that telecare had improved their quality of life during the program, and 69% of the clients reported being less concerned about the daily severity of their condition. But let's talk numbers as well. Daily telehealth supervision every day costs just over $7. Let's just compare that figure to the staggering $967 that is spent on average acute hospital bed stay. Beds, which of course limited in number and desperately needed. When Access Economics was commissioned by the Department of Broadband and Communications and the Digital Economy to provide a cost-benefit analysis of introducing a telehealth intervention into aged care, the results were staggering. Based on a targeted population of just over 17,000 older Australians, it was estimated that the intervention could save over $17 million in net present value terms, with a further $6.8 million in health savings. If the benefits from reduced pain and suffering are included, the total gross benefit is a further $9.5 million. Just imagine if this was deployed right across the country, if every household was connected to the world-class broadband. But here's the other component of this solution. To take advantage of telehealth, we need world-class medical-grade broadband. We need fibre-to-the-premise broadband. Unfortunately, when it comes to discussing the NBN, the Coalition, the government have sought to trivialise the benefits associated with superior broadband and pretended that is something that will benefit a small fraction of the Australian population. In fact, earlier this year, I appeared on a panel television show, The Nation, alongside Senator Erica Betts and Senator Peter Whish-Wilson. I was slightly horrified to hear what the Liberal Senator from Tasmania, my home state, had to say on delivering fibre to the premises broadband to every household and business. He said, and I quote, "It's like saying that every household needs the Rolls-Royce parked in the driveway." This is actually how the Liberal Party and the Liberal government think. But of course, we have heard even worse than that. It was in fact that our own Prime Minister who said earlier this year, and I quote, "The national broadband network is a luxury that Australia cannot now afford. The one thing you can't do is redo your bathroom when your roof has just been blown off." But it gets even worse again. When asked in relation to fibre to the premise NBM in December 2010, our Prime Minister said, and I quote directly again, "Do we really want to invest $50 billion of hard-earned taxpayer money on what is essentially a video entertainment system? A video entertainment system, a luxury that is likely to renovate your bathroom." That's how the Coalition, this government, views the NBN, as a glorified video entertainment system. Well, what if I was to inform those opposite me that the fibre to the premise NBN is almost certainly worth building for the health care benefits alone, especially for those older Australians who need day-to-day assistance to live their lives in the fullest extent possible. In fact, the former head of the National eHealth Transition Authority estimated that 30 to 40% of total NBN usage across all areas will be for health applications. These are applications that will, of course, be particularly valuable for our older and infirm. Fibre to the premise NBN is a massive infrastructure achievement that will enable older Australians to access medical-grade Reliance connections. We have to do this. We really don't have a choice. Even if we were to ignore the numbers, the cost benefits, the trials, the indisputable evidence that this is a superior solution, even if we were to ignore all of this, there's something else that I would like to remind everyone of. Embracing telehealth technologies through the fibre to the premise broadband makes an enormous difference to the lives of older Australians. And I have to say that in my new role as the Shadow Parliamentary Secretary for Aged Care, I've been able to visit several residential facilities and speak to older Australians, and I plan to continue to do a lot more of this and to speak about this important issue ongoing
Senator,
into the
probably
future.
your time's